Hi everyone, my name is Sydney John, and the title of my program evaluation is Suicide Prevention Quality Improvement in the Youth Services System, Perceived Needs and Experiences of Community Workers and Leaders. So the problem that I'm looking at here is youth suicide. So there's an increased need for youth and adolescent suicide prevention. As of 2017, suicide was the second leading cause of death for both the 10 to 14 and 14 to 24-year-old age groups. So a few risk factors for suicide in general include having a family history. So if a parent or a sibling, even a grandparent, aunt, uncle, cousin, anyone in the family has committed suicide, an individual is more at risk. Having a history of mental health issues, so that can include depression, anxiety, schizophrenia, exposure to suicide, so watching someone commit suicide either on a video or actually in person, and also both incarceration and residential mobility are also risk factors. So those two elements can greatly increase having a weekend social life, um, anything that can lead to fewer opportunities for developing healthy relationships with others and just having strong support systems. So right now, prevention services really focus on clinicians, behavioral health specialists, those types of people. And there's a real lack of training non-clinical community service staff that work with at-risk youth outside of a hospital setting. So an organization called Side Prevention has embarked on a mission to address that lack of training in the youth services sector. So Side Prevention was founded by Dr. Anthony Pisani from the University of Rochester. And Side is very unique in that it combines clinical expertise with a lived experience. So through the lived experience, Tony has partnered with a woman named Christina Mossgraber, who is a two-time suicide attempt survivor. So his entire framework is evidence-based. Him and a whole bunch of researchers have developed this new framework that includes connecting with individuals at risk for suicide, a new assessment model to really look at how at risk an individual is for committing suicide, a new method to responding to suicidal ideation or behavior, and then a format for extending an individual's role in suicide prevention after that direct interaction with an individual. Additionally, he and the entire SafeSide team implement their training or implement the framework through a unique training method, which is also evidence-based. They have trademarked this format. It's called in-place learning. It's unique in that it is video-based training, so it shows examples of how to actually use the framework. It shows videos of Tony and Christina speaking, and people actually watch the trainings in small groups led by a facilitator, so there's live discussion, and it's a really unique way to go through a training. They right now have specific trainings for a variety of settings, which include behavioral health, youth services, primary care. It's also a unique program in that they offer follow-up office hours. So once a month after training, people are able to tune in via Zoom, which is kind of like a conference call website, and they can ask Dr. Pisani questions, any other members of the SafeSide team questions on how to implement the training. So an inter-organizational collaboration that's occurring right now is with the Hillside Family of Agencies in Rochester, New York. It's a large youth services organization that is actually national, but one of their larger branches are in Rochester. The agency provides child welfare, mental and physical health, youth development, juvenile justice, special education, and developmental disability services. So the partnership between Hillside and SafeSide is currently the largest partnership that SafeSide has to date. They are training the entire Hillside team regardless of program, education, all staff are getting trained. Additionally, we are looking at the partnership through evidence-based elements that have been shown to be effective in inter-organizational collaboration. So that includes trust and interdependence, and also includes the reach and scope of activity. So making sure that all of the intended practice changes are the actual practice changes. So this program evaluation has several questions. First being, is the safe side prevention training effective in improving the quality and service being provided for youth presenting suicide ideation and behavior? Second, is the partnership between safe side and hillside efficient? Third, are there any possible improvements that could be applied for future agency collaboration? So overall, the objectives include analyzing the current strategies to identify any gaps in knowledge, evaluating the effectiveness of training, the suicide prevention and assessment culture change within the Hillside staff, and evaluating the efficiency of the partnership. So in order to evaluate the efficacy of the training, a handful of youth services staff from Hillside, from all different programs, all different positions and education levels, were reached out to by program leaders, and those individuals then expressed interest in participating just based on scheduling and their ability to participate. So of 50 contacted, 17 followed through. So the qualitative data collection piece of this program evaluation included a pre-training interview, so interviewing staff before they went to training, asking them what their current practices are, what their challenges are in suicide prevention. The post-training interview served as a knowledge check, seeing how efficient the training was and if they were able to remember the framework, and also served to determine whether or not there's a culture change to see if their perceived role had been affected by training and if their current practices had been improved. The third form of interview was with the leadership staff of both the Hillside and Safe Side teams. So those questions included asking them what they thought of the partnership, what made it effective, opinions around the actual functional partnership. So all of the interviews were approximately 20 minutes long. They were all recorded and then transcribed, and all the responses were compared. The comparisons occurred between other participants, so that is how we identified any themes across questions. And also the pre and post questions, the responses were compared within individuals to identify any changes and improvements to practice. The results are to be determined. I am finishing up my data collection next week, and then I'll be piecing everything together from there.